people who don't even have access to radiologists to report the images that that the images of the images that they take in centers where, so in countries where they even have these imaging modalities. And now to that study, this this data was documented by WHO. Now to bring it to Africa, it's even worse. In some countries in Africa, there are just one radiologist to over 5 million people. To come to Nigeria here, we have over 210 million people and less than 300 radiologists serving these people. If you look at that ratio, that's between one radiologist and an average of like about 700,000 to a million people. And that's, that brings about the shortage of radiologists. And furthermore, if you look at it again, there's a poor storage infrastructure in terms of how images are being, acquired, how they are being stored. There's no robust server system that can host these images, and you get to start finding people that has done X-rays or CT scans or any of the imaging modalities for the past 8 years or 10 years, and they come for a follow-up, and we can't have access to these images. To also speak about the non-standardized methods, you can be so shocked that your X-ray or CT can be found in someone's WhatsApp, on someone's WhatsApp, or somebody's email, or someone's WeTransfer, and other methods that are used to report images currently. Also, if you look at it, there's a delayed waiting period in the facilities. Someone comes for a chest X-ray or for a CT scan, and then he has to wait a long period. Why? Because there's shade of radiologists to even report these studies, right? And this also makes the process very expensive for the radiologist, because they have to move through different facilities to attend to different patients. It will have to take the hospitals also, different costs such as logistics and all that costs to deliver this service to their patients. And in turn, because the radiologists are not so many, they're very few, they have to go around the clock, do so many images or report so many images, and then you start seeing misdiagnosis. The standards globally of a doctor to a patient is meant to be in ratio of 1 to about 1,000, and that in itself is even so much compared to 1 to 1 million. And misdiagnosis eventually can lead to death and high mortality rate, as it were. Emergencies coming into the hospitals, and then there are not people to attend to these emergencies quickly, and then we have death, increased mortality rate. Now, what's our solution? Our solution is a platform, a robust platform, all-in-one platform that connects the patient to hospitals and radiologists from anywhere in the world and anytime. This platform is cheaper, it's faster, it's more convenient, it is more accessible. Now, with a click, radiographers in different hospitals can now send their images to the cloud, and radiologists across the world can have access to that image and then report it. Hello, can you hear me? Hello?
Yes.
Yes, we can.
Okay, so I can go ahead, right? All right. So Instant Rad is that one all-in-one platform that connects the patient to the hospitals and to radiologists across the world. And this is cheaper, it's faster, it's convenient, it's accessible, and it improves healthcare service delivery. How do we do this? We have a robust cloud solution and a local storage that helps save these images and store them easily accessible anytime and from anywhere. We also set up within 30 minutes or less, set up several hospitals to be able to, push these images on the cloud and then have their own radiologists report it. We also encourage radiologists to come together to form a company and to also, offer services, radiology services to patients and to hospitals that they, serve. And our unique feature, the second opinion feature, is where someone can go outside of a particular hospital to
You have
do
1 minute.
yeah, great, thank you, to do an x-ray or a CT scan, and then you can upload it to Instant Rad and then get a report. Where are we today? We started in 2018. We focused on in Ghana, and we've moved in 2019 to Nigeria. And currently, we have over 30 hospitals, averaging 100 to 150 cases per day, 15 million medical images, over 60,000 reports generated. Our turnaround time has not reduced, between from 3 to 30 days to about 30 minutes for urgent cases and 2 to 4 hours for normal cases. We currently have 120 radiologists registered and 95 radiographers registered. These are our clients, current clients that we have here in Nigeria and across the world. This is the platform. Has several interfaces: hospitals, radiologists, referring physicians, and patient interface, and they all log in on one platform. Our total address. Say it again.
Please round up.
Yeah, this is my last slide actually. Our total addressable market is about $600 million in West Africa and over $2 billion across Africa, with our second opinion market, as I explained earlier. And what's our competitive advantage? We're very simple, flexible, easily accessible. It's an all-in-one turnkey RAD solution. We have a seamless HL7 FHIR integration that helps integrate with other platforms that can serve as partners to Instant Rad. And currently we're in Nigeria, currently doing great and impacting lives, shortening turnaround times in different facilities, and making sure that healthcare service delivery is optimal. Thank you.
Thank you very much, Bayo. Let Bossa present, and then we'll come back to the question. Sorry, Ame. But you're a co-host now, so you should be able to unmute yourself.
Oh, okay. Good afternoon, everyone.
Great.
My name is Usari Meroya, and I am the Chief Credit Officer for Atheria Africa. Can you hear me?
Yes, we can hear you.
Okay, I'm trying to share my screen. Trying to share my screen. Just 1 minute, please. Oh, okay. Okay, can everybody see my screen now? Can everyone see my screen, please?
Yes.
Hi. Yes, please.
So your 4 minutes starts now.
All right. We are Atheria Africa, and what we do is we finance healthcare solutions, and we give money to people who are qualified for healthcare services. Basically, we provide a care now, pay later service through our platform. So the problem in Africa or in Nigeria, use case Nigeria, is that most African healthcare SMEs, they cannot actually have